Hey everyone, it's Dr. Jess. Welcome and welcome back to my channel. In today's video, we're going to talk about diuretics. So we'll go over thiazide diuretics, potassium-sparing diuretics, and loop diuretics. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. Let's talk about the mechanism of action of the different types of diuretics. Thiazides work by inhibiting sodium reabsorption in the distal convoluted tubules. Potassium-sparing diuretics compete with aldosterone at the receptor sites in the distal convoluted tubule and collecting ducts. Loop diuretics, they block sodium and chloride reabsorption in the thick ascending loop of Henle. Let's look at some common medications in each class. So common thiazides are hydrochlorothiazide, chlorthalidone, indapamide, and metolazone. Potassium-sparing diuretics are spironolactone, eplerenone, amiloride, and triamterene. And for loop diuretics, we have furosemide, torsemide, bumetanide, and ethacrenic acid. Let's look at this practice question together. Which of the following drugs is a loop diuretic? Determine its brand name. I'll give you 5 seconds to write your answer in the comments below. If you chose D, furosemide, then you are correct. So let's look at why the other answers are incorrect. So A, chlorthalidone is a thiazide diuretic. B, enalapril is a ACE inhibitor. C, spironolactone is a potassium-sparing diuretic. It is an aldosterone antagonist. So D, furosemide, is the right answer. Furosemide is a loop diuretic. And the brand name for furosemide is Lasix. Now we'll go over some of the common side effects with the different diuretics and what to monitor. So thiazide can cause hypokalemia, hyperuricemia, hypercalcemia, photosensitivity, and rash. And be mindful that this list is not inclusive. There are other side effects that are not listed here. Monitor renal function, fluid status, blood pressure, and electrolytes. Potassium-sparing diuretics, on the other hand, unlike thiazides, they cause hyperkalemia. They can also cause increased serum creatinine, gynecomastia, which is with spironolactone specifically. And when it comes to monitoring parameters, monitor potassium, blood pressure, electrolytes, renal function, and fluid status. Loop diuretics can cause hypokalemia, hyperglycemia, hyperuricemia, ototoxicity, and that's hearing loss, tinnitus. Monitor renal function, fluid status, blood pressure, and electrolytes. Which of the following medications can cause hyperkalemia? Write your answer in the comments below. I'll give you 5 minutes again to write your answer. You got that right. B, spironolactone is the right answer. So let's look at the other answers and see why they're incorrect. So A, hydrochlorothiazide is a thiazide diuretic. Thiazide diuretic cause hypokalemia, not hyper. C, chlorthalidone is also a thiazide diuretic. And again, thiazide cause hypokalemia. D, furosemide is a loop diuretic. Loop diuretic are known to cause hypokalemia. So that makes the correct answer B, spironolactone, which is a potassium-sparing diuretic and can cause hyperkalemia. Let's look at contraindications and precautions to be aware of when it comes to diuretics. So, with thiazide diuretics, hypersensitivity to sulfa. So, there's a potential for cross-reactivity with sulfa drugs. And if you have anuria, it is contraindicated. Potassium-sparing diuretic, as I've mentioned before, they can cause hyperkalemia. So if you already have hyperkalemia, it is contraindicated. Spironolactone, most specifically, was shown to be a tumorigen in chronic toxicity animal studies, so something to be aware of. For loop diuretics, also contraindicated in case of anuria, and then also potential for cross-reactivity with sulfa drugs. Ethacrenic acid which is one of the loop diuretics, has no cross-reactivity to sulfa. So if you're looking for a loop diuretic that has no cross-reactivity to sulfa, that would be the option. Which of the following is true about the use of spironolactone? A, it can cause hypokalemia, therefore check potassium at baseline, then frequently thereafter. B, it works by blocking sodium and chloride reabsorption in the thick ascending loop of Henle. C, it can cause gynecomastia. D, none of the above. Again, write your answer in the comments. 5 seconds. All right. So let's look at the options we have so we can figure out what the answer is. So A, it can cause hypokalemia. Is that true or false? So that is a false statement because spironolactone, remember, is a potassium-sparing diuretic and they can cause hyperkalemia, not hypo. So that means it is not A. So let's look at B. It works by blocking sodium and chloride reabsorption in the thick ascending loop of Henle. So, spironolactone, potassium-sparing diuretic, is that how they work? The answer is no. So this is again a false statement. The loop diuretics work by blocking sodium and chloride reabsorption in the loop of Henle. C, it can cause gynecomastia. That is a true statement. Spironolactone can cause gynecomastia. So that means the correct answer is C. That's it for today. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell. I'll see you in the next one. Bye.